The second you see your MRI report, I'll bet you read it. Right there, wherever you are, it says degenerative changes or complex tearing or maybe even bone on bone. Often patients see that report before they see me or whoever's supposed to follow up with them after the scan. So by the time you get to my office, you've already decided you need surgery. Let's slow that down just a little bit. You having your own records is a good thing. You should be able to read whatever you want, including your report. I think it's great. But the problem isn't access. The problem is the report was written for me, not for you. So here's the part that surprises most people. For example, in my world, for hip and knee arthritis, you usually don't need an MRI at all. The test I want most is a weight-bearing x-ray. I want you standing on your feet, your body weight going through the joint, because I'm not really looking at the bone. I'm actually looking at the space between the bones. Now, cartilage doesn't show up on an x-ray, but the gap it holds open does. So when you stand up, that gap between the bones, that's my measurement. Think of it like checking the thickness of a tread on a tire. There's a whole video on that one, by the way. Bones do close together over time. So like a tread on a tire would wear, the bones can come closer and closer together. And eventually, they become bone on bone. In fact, that's exactly what bone on bone means. No cartilage in between. An MRI that you had laying down can't tell me as much as a staining x-ray can sometimes. So now those words that you might have read in the report. Degenerative changes means tissue that's worn or aged or matured. That's it. It's just a description. It's not a diagnosis. And here's the thing that patients are really never told, or at least they're not told enough. A finding can be completely true and still not the cause of your pain. It's not your problem. Your report can accurately describe degenerative changes, for example, in a tendon. And that tendon is actually not in the area where you're hurting. Both things can be true at once. To illustrate this, I often tell people this report, this statistic. If you get an MRI of everybody's knee, I mean everybody, people without knee pain, about a third of patients would have a meniscus tear. And in fact, in one study of patients a little bit older, age 50 to 90, 61% of those patients had a meniscus tear on MRI, but had no pain, no aching, and no stiffness for the previous month. 61%, no symptoms. So a tear on a report, just like a tear on the MRI, does not mean that that tear is the cause of your pain. And degenerative tearing often means just softening. So the tissue is kind of on its way to a tear. It's not fresh tissue, but it's also not a fresh injury. Which brings me to the part that really gets under my skin a little bit. Sometimes a patient arrives having been told off a report alone that they'll need surgery, usually by somebody outside of orthopedics who is just trying to help. And I do appreciate the help and the direction, I mean it. But a report read without the person attached to it can send you down the wrong path entirely. Your story comes first. Your symptoms come first. What hurts? When does it hurt? What can you not do anymore that you used to be able to do? Then we correlate that to the picture, not the other way around. So what do you do with the report that you have in your hand? Bring it. Absolutely bring it. Just don't let it decide before you get to the appointment what the right treatment is. Ask which findings on the MRI report actually explain your symptoms. Ask whether a standing x-ray would tell the doctor and you more. And ask about changes about the treatment. A lot of times, the information from the MRI and the MRI report will not ultimately change your treatment, at least not initially. The full write-up, including the words you're most likely to see in your MRI report, is linked below. But what did your MRI report say that scared you? Put it in the comments. I read them all. I'll answer. Thanks for watching.